This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
As with most types of cancer, oral cancer can be particularly fatal if not given the necessary medical attention.
Oral cancer, majority of the oral cavity cancer would be squamous cell carcinoma, which just continues to grow, aggressive growth of a tumor.
Oral cancer can develop in any part of the mouth, such as the tongue, lips, gums, and inside its inner linings. The problem normally arises when those affected fail to notice the signs and symptoms. These include bleeding in the mouth, a lump in the neck, bad breath, and significant weight loss in a short amount of time.
The best time na magkonsulta ka is the time na meron kang ulcer, or parang singaw in the mouth, and then it doesn't disappear. We normally say in a month's time, 3 to 4 weeks. Pag hindi nyo nawawala, in fact, it stays on and is progressing, better have a consult. The earlier we detect cancer, the better for the patient.
The risk is greater if a person smokes, drinks heavily, has a diet that is low in vegetables and fruits, and is infected with a virus called human papillomavirus or HPV.
If you don't do anything about it, it will continue to grow. And when it starts to grow, it will affect nerves, so you'll have pain which are very severe. And then, of course, foul smell in the mouth, you'll have inability to eat or to drink. And then, of course, later on, if it has gone very big, it could obstruct the area for breathing, and so that usually is the cause of death, like asphyxia.
While oral cancer is often fatal, deaths from this disease can be trimmed down significantly with early detection, timely treatment, and intervention.
So how do you prevent it? Don't smoke cigar, don't drink, again, drink moderately, and of course, good fitting of your denture and good oral hygiene.
Is oral cancer common in the Philippines? What are the treatment options available for those with oral cancer? Find out the answers tonight on MedTalk.
Joining us tonight is Dr. Norberto Martinez, an otorhinolaryngologist from the St. Luke's Medical Center. He's also the chair of the Philippine Academy of Neurology, Otology, and Related Sciences. Also with us tonight is Dr. Gil Vicente, an otorhinolaryngologist from the St. Luke's Medical Center. He's also the director of the Philippine Society of Oncology. You may join the discussion by calling our hotline at 548-4678. Good evening, Dr. Martinez and Dr.
Hello,
Vicente.
good evening, Angel.
Welcome
Good evening,
to MedTalk. We'd like to know your practice a lot more, better, to maybe even pronounce it. Otorhinolaryngology. Please define this for us. Let's start with you, Dr. Martinez.
Yeah, basically the full name of our specialty is otorhinolaryngology, head and neck surgery. In other words, it's ear, nose, and throat, head and neck, to simplify things.
ENT.
Yep, ENT. Not ENT, EENT. Kasi,
EENT.
most people still have that EENT. But generally, we have been separated from the other E, which is the ophtha part. And now, specifically, we're now into ENT, or otorhinolaryngology, head and neck surgery.
Okay, so off-cam, Dr. Martinez and I were talking, and oto is the ear, rhino,
nose,
and throat. Yeah, that's right.
Okay, thank you for defining it for all of us. Now, what diseases fall under this specialty of yours, otorhinolaryngology? Dr. Martinez.
Yeah, ear problems basically, hearing loss, dizziness, ear infection, We have rhino problems, nasal obstruction, allergy, you have masses in the nose, and of course oral problems like the topic for today is oral cancer, and throat problems like hoarseness, difficulty of breathing, even foreign body that can lodge in the air and food passage is part of our specialty.
So
for-
also
Yes,
the particularly we're now into head and neck. No, the neck in particular. Any bugs in the neck should be also be consulted to our specialty. So thyroid, we do thyroid examination as well, and thyroid surgery.
Also.
So also in the salivary glands, the parotid glands, as any mass in the neck, lateral or in the central part of the neck. So we have to be very careful and very thoroughly examine these areas.
Okay, so we will thoroughly examine a particular area of your specialty, which is the oral cavity. So what diseases can happen inside one's oral cavity, Dr. Martinez?
Well, you can have a lot of lesions in the oral cavity. Very common is stomatitis, or in Tagalog we say it's singaw, no? So any lesion that you find there, no? Sore throat, which may be infection or otherwise can be a lesion that or a complaint that patients may have, no? Other problems like tonsils, which is of course inflammatory in nature, but of course our focus for tonight is malignancy or oral cancer. So any mass, any lesion, any discoloration, be it white or red in nature that affects the oral cavity is something that we have to look into.
Oral cancer, what is the incidence of this happening in the general population, Dr. Vicente?
Usually, there would be 3,000 new cases per year, okay? And it would usually be around 1,800 would die of this kind of problem. Okay, so actually the oral cavity would involve the lips, okay, inside of the lips, the gums and the teeth, the cheek area, okay, the buccal mucosa, and the tongue, floor of the mouth, which is underneath the tongue, the palate, which is above there, and then the tonsils. Okay? So all of this, and also at the back of the wisdom tooth, there's what we call the retromolar trigone, which sometimes would hide some lesions there. So we have to be very careful in looking into that area. So anything which we see in that area can definitely be malignant. Okay, so we have to be very careful, and they should really have it examined very thoroughly.
Can we examine your model here and point to us, doctors or Doc Martinez, the areas where
So
Dr. Vicente
basically,
mentioned?
we're looking at the oral cavity. So any lesion that may affect the junction of the lips now, you could have a lesion in the lips, so you can have a problem there. This is the area of the gingiva, of your teeth here also. Then of course the tongue. The most common oral malignancy is actually a lesion in the tongue, usually on the lateral tongue. You can have a problem at the base of the tongue also, which is usually seen at a later stage because the patients that not have early manifestation. You can have a problem also in the palate, be it the hard palate or the soft palate. No? This is the back of the throat also, so it could affect the oropharynx, as we would call this area, and even below here we call the hypopharynx. So any lesion that affects that region is something we would label as oral or mouth cancer.
You mentioned lesions. What type of lesions should one watch out for?
So any kind of lesion, just a whitish lesion with a halo, the frequently what we call singaw, can be, which lasts for about 3 weeks. So it can be there for a week, it can be there for 2 weeks, but if ever it lasts for more than 3 weeks, then it should be guarded.
As simple as a singaw.
It's a singaw,
It can
yeah.
lead to oral cancer?
Yeah,
Is that what
later
you're
if
saying?
it stays that long in your mouth, then we have to be very careful. Go to your ENT specialist right away and have it examined.
What other lesions should we watch out for aside from the singaw that, every once in a while someone has, di ba?
Yeah, bleeding areas. So bleeding areas, the gums, the something hidden beneath the tongue, the floor of the mouth, again at the back of the wisdom tooth. Okay? So whatever, so anything which also produces foul smell. Sometimes it can begin with the halitosis, and then we have to really to discover what it is. Any foul-smelling area, in that area should be examined.
Is there a particular age where we should be more conscious about our singaw that lasts for 3 weeks, or maybe halitosis that doesn't really want to go? You've done everything, no? Oral care, and still it's still very bothersome. Dr. Martinez.
Yeah, usually the involved age will be in the elderly, say for example age 50 and above, they are at higher risk. Males are at higher risk compared to females. Before it used to be a 6-to-1 ratio. 6 males is against 1 female, but the ratio now is reversed because of some lifestyle changes also of women. Women smoke more than the usual, no? So now the ratio is 2:1, 2 males and 1 female, no?
Wow.
And usually the age was said to be 50 and above. Now the age is actually going lower this time. It's about 40 and above. The reason being is it has something to do with a virus called human papillomavirus.
The HPV virus.
Yeah, HPV, which is actually the most common sexually transmitted disease now.
Okay.
Especially also because a lot of our young population now drink wine and do smoking also, even among teenagers. Okay? And also with regards to age, then definitely it could be in a younger and even at about 30s, 40s, 50s. Now, definitely during our times, we read it as only 50. At our times, would be about 30 years ago.
Yes, our times. But
So
now
50,
the incidence has...
like heart disease. No?
Yes.
We've learned about, we know about somebody having attacks even as early as 30.
Yes.
So the same is true with cancer.
We'll talk about oral cancer being contagious. We'll talk about the signs and the symptoms of oral cancer when MedTalk returns.
Did you know that today, oral cancer can now be detected by a scanner that can identify oral malignancies through mouth lesions with a 95% accuracy rate?
We're back here on MedTalk, still talking about oral cancer. Doctors, before the break, we were talking about smoking, drinking, that are certain risk factors. When you share a drink with someone, is that contagious? Can you have lesions shortly after sharing a drink with someone, or maybe puffing from someone's cigarette?
Generally, it's not a communicative disease, no? A communicable disease. So it cannot be transferred from one through fomites or to drinking. So don't worry.
Okay.
Yet.
No, don't worry, but still, ano naman, hygiene pa rin.
Hygiene
don't
pa rin.
share na lang
Don't
your
share.
drink or puff from someone else's cigarette.
Yeah. Pero parties, usually it's
Can't
done.
help it eh. Oh, you can't help
Or
it.
in tagay-tagay, it's a kanto. Or with friends.
But you won't transfer the disease that you have here, no? The detection, doctors, early detection of a lesion or bleeding gums or an abnormal maybe texture of your cheeks, the inside of your cheeks. How important is this, and who should they seek advice from? A dentist because it's the oral cavity, or should they go immediately to an otorhinolaryngologist?
Yeah, early detection needs to be really emphasized because they found out that if they are discovered stage 1, meaning the lesions quite early, the treatment or improvement is 90% survival, no? So that's very important. So if you are discovered at a later stage, say stage 3 or stage 4, the survival rate goes down to about 50% in 5 years. So early detection needs to be emphasized, no? If you have a problem in the oral cavity, well, you can actually go to a dentist, no? Or if there's a lesion, you can actually see an ENT doctor as well, no? The recommendation is for patients whose age is 20 and above, you can have a general oral exam with the dentist every 3 years, no? But if your age above 40 and above, then it's recommended that you have an examination by a dentist every year. It's like, having prophylaxis,
Yes.
that, it's a general exam, no? But if there's a lesion that you actually see, then it's best that you go see an ENT doctor who will take note of the lesion, because sometimes, it may be something that is, benign looking or nothing really suspicious, but on further examination, then it could be something else.
There are other signs and symptoms which we should be aware of. Earache. Earache can be a sign of something there inside the throat, because there is usually a connection between our nerves in the ears as well as in our throat. So once we have this kind of hearing pain, ear pain, okay, so we should be aware of that. It should also be the mouth should also be looked into, and also bleeding. As I already told you about bleeding, even blood-tinged phlegm. Yes, blood-streak phlegm should also be taken into consideration. And we talked about, we've learned about foul breath being also a sign of this kind of problem. So, and everything which a jagged tooth, okay, ill-fitting dentures can be cause some lesions in the mouth or in the gingival area, or anything which is teeth which is loose, okay, because underneath there could be something wrong there. So we have to look into these things also.
You mentioned the ear. I just want to go back to that. What is the level of pain that one will experience for that individual to consult
it can be
the
a
doctor?
dull pain, it can be a piercing pain.
Is it
So any
ringing
kind of
pain? Would it happen to be ringing pain as well?
ringing.
Ringing, yes. Ringing in the
Yes,
ears.
sometimes it can be a ringing pain. Okay? And but generally it could be just a dull pain, a piercing pain, which is usually recurring and or lasting for an unusual period of time. Should be investigated. And if we look into the ears, there's no pathology, then we have to look into the oral cavity.
Okay, so you look into the oral cavity. What are you looking for, Doc? What kind of tests will be administered to the patient to detect if they do have a benign tumor, or maybe it's already oral cancer?
Just a simple look into the throat. The tonsils can be enlarged. The tonsils can have a singaw, okay? Or anywhere in the tongue, okay? Or the teeth. The teeth, there can be some dental caries, and this could also be manifesting in that way. And if I told you if it's a loose disease, then underneath could be also a problem, and therefore can reflect into having an ear pain. So, so it's any kind of lesion, okay, whether it's already big. So the tonsils can be, sometimes the left tonsils may be big, but the other tonsils is small. Okay, so any disparity or any asymmetry should be investigated.
Tonsillitis. Sometimes even a self-exam, no? When you open your mouth, you can see pus in your tonsils. How long should that pus be there for it to be just your normal tonsillitis, or maybe it could lead to something more bothersome or more alarming?
Yeah, if it's tonsillitis, there's pus, it's inflammatory, you have fever, it's red, no? So we expect you to get better after having taken antibiotics, no? And it is usually, as Dr. Vicente mentioned, if it is asymmetric, the patient does not really have fever, there's no pus, there's practically no pain, there's just difficulty of swallowing because of the huge tonsil, then that is a red flag sign.
Okay. Do you have to get a blood test? Do you have to get an X-ray, a dental X-ray maybe, an oral X-ray? How?
Not really. If you find an unusual lesion, as we said, no, if it lasts longer than 2 weeks,
2 weeks.
the definitive diagnosis rests upon a biopsy. That's the definitive diagnosis, which can be done under local anesthesia with just a bite. No, that will be the simplest way, and it's of course documenting now histologically that there's indeed malignancy.
Okay.
But before that, if they don't want to have it biopsied, because it can be expensive, it can be painful. Sometimes we do some preliminary investigation, like the brush test. We brush some of the lesion and then send it to laboratory. Or we do some examination using a special imaging technique, which is when we applied over the lesion, can reflect some unusual behavior or unusual description of the mucosa. And this is available here now in the Philippines, and we have looked into that. And if we really if there's really a lesion in there, then we probably should have it investigated and have the biopsy done right away.
So in the event that there is something suspicious inside the oral cavity, what is the next step after the biopsy? Let's say the patient agreed to have the biopsy. What is the next step?
Okay, if it, after having done the biopsy, turned out to be malignant and 90% are squamous cell carcinoma, now we try to map out the lesion. So you may want to do other testing like radiologic studies, for example, a CT scan, an MRI, even a PET scan, PET CT if the lesion is extensive, meaning it's stage T3 and T4, meaning the size of the lesion is really big. No?
Okay.
So those are studies that we need to do to try to plan out the treatment that we are intending to do.
So planning out the treatment, how extensive should the treatment be? Is it, does it mean that, for example, it's stage 1, 2, 3, 4? The treatment, of course, will be different per
so
stage.
that's
no?
why we do imaging techniques, especially in the neck. We do CT scan or MRI or even PET scan in order to determine whether there is already a neck node in there. So a neck node would definitely put it into an advanced situation, advanced stage of cancer, whether it's big or small. Okay, definitely, once the lesion has transgressed or metastasized or placed in an area in the neck, then definitely it is now an advanced case, and definitely the treatment is different from an early case and a late case, late stage cancer.
Before we go to our Twitter question, doctors, what is the most common type of oral cancer?
Well, in the oral cavity, the most common is a tongue CA, and it usually affects the lateral tongue, the side of the tongue, and 90% are squamous cell carcinoma.
Okay. Again, please help us understand squamous cell carcinoma.
Yeah, it has something to do with the epithelial lining of the tissues, because in the oral cavity you have that squamous epithelium, and once there is a proliferation or over-proliferation of these tissues, then, you know, after a biopsy, it turns out to be a squamous cell carcinoma.
That's the usual cause in head and neck, squamous cell carcinoma.
Okay.
In the breast, it's the intraductal invasive carcinoma. So in each of the organs, there's usually a dominating histologic event which is taking place. So in our place, 90% is squamous cell carcinoma.
What is the cause of cancer in this area? That you said it's the tongue that is most common.
Yeah.
What would be the cause of that?
As we said, there are predisposing factors, no, like alcohol, for example, cigarette smoking, betel nut chewing. As we said, diet also may be a precursor.
Okay.
If you're exposed to a carcinogenic environment, also maybe in the workplace, like you get exposed to asbestos. No, these are, and in the tongue, the most common is irritation because of, say, for example, ill-fitting dentures. The constant trauma and irritation can lead to such growth, malignancy.
Okay.
And also in the provinces, we still see inverted cigarette smoking or tobacco. very common in the among the elderlies. No? So and then also betel nut chewing, not just betel, they put amog, apog.
Okay.
And the fact that it has apog and the fact that it has betel nut chewing increases the incidence of oral cancer.
Is oral cancer preventable? We'll talk about that when MedTalk returns. We're back here on MedTalk, still talking about oral cancer. You may join the discussion by calling our hotline at 548-4678. Doctors, now it's time to go to our Twitter question. Do I need a yearly checkup to detect if I have mouth or oral cancer? Dr. Martinez.
Yeah, as I said, it's the recommendation of the American Dental Society. Actually, if your age is 20 and above, you have a checkup every 3 years. But if your age is actually 40 and above, then annual checkup of the oral cavity is important. But you can actually do self-examination as well. All you have to do is face the mirror, okay, have some light reflect on that oral cavity so you can inspect if there's anything unusual looking in your oral cavity. Is there a white lesion or a reddish lesion? That's by inspection. You can actually palpate. You can, with your finger, of course, you can try to feel the tissues in your oral cavity, whether it's the cheek, the undersurface of the tongue itself. Then that's one way of self-examination. It doesn't take too much, so you can do that every so often.
You need not visit your
Even the
dentist
neck. Don't
if you can
forget
do it.
the neck.
Okay.
So you palpate for the
Important
neck,
is there.
bilateral palpation,
Okay, how do you-
using the hands. Okay, you apply it underneath your jaw, okay, and then at the middle, and then down, okay, and then you have to swallow sometimes. Swallow. If
Okay.
swallowing can tell us that there's something wrong inside the throat or the neck. But swallowing basically pertains, if there's a mass there, pertains to the thyroid, okay, but this is not anymore part of this discussion. And then we can palpate towards the lateral portion of the neck and then towards the back of the neck. So all of this palpation is very important using our hands. So anything unusual should be told to the doctor.
Sometimes when we have a fever and we know that, you know, we check our lymph nodes, no, kung namamaga. That's one telltale sign that there is something or that you are sick. So every once in a while, if you feel that you know, you've been exposed to certain risk factors that you've mentioned, then you check your neck, you check your ears, your nose, and your oral cavity. In checking also, do you have to check your family history? Is this passed on from one generation to another? Dr. Martinez.
That may be a risk factor also, but it's not really strongly implicated. No?
Okay.
But in just a recent study, they say it does not necessarily because of our poor nutrition, our food, our environment, not necessarily because of our genetics. It's because of bad luck. You know that? It's bad luck.
They call it
There
bad
will be
luck?
mutation.
Okay.
Especially in the skin. The skin usually has a lot of replacement of cells. And in the process, they can mutate. And this mutation can already mutate into something bigger and bigger as time goes on. So that's not what we call bad luck. That's the cause of our cancer nowadays.
But we can reverse that bad luck. Isn't that correct,
yeah, you
doctors?
can reverse it bad luck. hopefully.
So it's preventable. We want to reverse the bad luck. We want to be healthy. Sometimes we don't necessarily want to live a very long life, but quality living. So is it preventable, doctors? Is oral cancer preventable?
It is. Knowing the risk factors, so we can prevent, I mean, of course, smoking, alcohol, drinking, diet as well is very important. It is said that if your diet is high in fruits and vegetables, then, you know, that is a plus factor for you, no? They came up with a study in 2009, no? And they found out also based on the local studies, like, if your intake of patis once or twice a month, they found out, and if your intake of bagoong also once or twice a month has a positive factor for the prevention or the prevalence of this. No, this is a local study they found out. No,
Okay.
even taking high risk factors also like salted fish is again something that we need to avoid as well.
So taking your daily dose of fruits and vegetables and living a very healthy lifestyle, no?
Of course, the fruits and vegetables, okay? Serving of vegetable, that prevents us from, those are antioxidants which help us become more, we become stronger and become more immune to any kind of diseases. So aside from what Dr. Martinez said, I think what is important to remember is alcohol, as much as possible. There's now a lot of rinsing mouth rinses which are very, very alcoholic or very, very acidic.
Okay.
So as much as possible, especially the strong ones. So definitely the longer time we expose our mouth to these alcoholic rinses, we may be seeing a lot of problems with this one later on. Also, we've talked about HPVs, and this is due to oral sex. Now we have related oral sex and oral cancer. So because of our promiscuity, so this is also preventable. So as much as possible, one man, one woman. No,
So that you don't, so that you prevent the spread of the
spread,
disease,
yeah,
no?
yeah. So one-to-one only.
Okay.
Be loyal and true.
And in staying loyal and true to what we're talking about tonight, doctors, the complications of, in the event, that you have been diagnosed with oral cancer, what are some of the complications that may happen to your quality of life?
As we said, no, generally they are diagnosed late, meaning the tumor is quite big already. No,
Okay.
it could be more than 4 centimeters in its greatest diameter. So which means you have, for example, difficulty in swallowing, difficulty in speech. No, if the tumor is going near your dentures, then you can have loosening of the teeth as well. And one common factor that we encounter is you have halitosis. You have foul breath because of the tumor itself. No, so your oral hygiene becomes, of course, affected as well. So those are the common problems that you will see. And of course, after the treatment, because of the extent of the tumor, if the tongue will have to be removed, then again problems set in. Difficulty of speech, difficulty of swallowing. So it depends on basically the size of the tumor itself.
You mentioned the tongue will be removed, and this is the most common type of oral cancer. Tell us more about this, doctors. What type of lesions do we find in the tongue? And then are there certain stages also of this type of cancer? And then once the tongue is removed, it will for sure affect your speech, your
So the tongue,
eating.
the tongue can not necessarily remove altogether as one. So if it's only found in the lateral, okay, you can actually remove just a part of it with the 2 centimeter margin. Okay, if it does not extend to the other, so if this is your center, then if it does not extend, if it's only in the lateral, if it's only you can have a 2 centimeter margin and then remove that. Okay, generally you can rehabilitate, you can still talk intelligibly. So that's not a big problem. So, but once the tongue has involved the other side, gone to the midline, we have a midline there, just right at the middle, and then definitely it has to go. It has to be removed and then replaced with. We usually have flaps. We get it from different kind of areas in the chest, in the shoulder, and then put it to put some bulk in that. But generally, you now may be unable to talk intelligibly. But you have the bulk, you have the
So it's
no
reconstructive
sensation.
surgery already, so that you still have the tongue, so to speak, tongue
Yes.
replacement.
And sometimes the jaw can be also be removed. Okay, so and once removed, we do some reconstruction there of the jaw as well.
How about, let's say that you reconstructed the jaw, reconstructed the tongue. How does the patient proceed now with something like that, with the reconstructive surgery that has been done to the oral cavity, Dr. Martinez?
So they go for rehabilitation. Of course, speech rehabilitation
therapy,
is
yeah.
very important also. So swallowing rehabilitation, those are the things that we can actually work on. No? So because function is very important also, that's a reason why you need to put a bulk there, okay? You need to recreate a gutter for swallowing and for the accumulation of saliva. So those are things that we need to work on. No?
How about the support group? Is there a support group for those who have been inflicted with oral cancer? Doctor?
Here in the
Sandra.
Philippines, we have general support group generally for cancer, and then within that group they have head and neck group, which make sure that they give support to each and other individual. So, but definitely support group should start at home. Okay, the very caregiver, the mother, the father, or even the husband or the wife should be the first one to give the support. Okay? So in the Philippines, we're okay because we have a good family relationship.
Yes.
But abroad, I don't know. I mean,
Yes, so we
Because
can only
generally-
speak for the situations here in the Philippines,
Yeah.
no? And Filipinos are really maalaga, no?
That's
When one is sick, when one feels na kahit lagnat lang, aalagaan naman talaga. I asked that question because when we come back, a World Cancer Day is coming up. So we'll talk about, you even brought a book, Dr.
Yep,
Vicente.
yep.
We'll talk about that when MedTalk returns.
According to a study led by Renelson Esguerra of the Tokyo Medical and Dental University in Japan, oral cancer will emerge as one of the new major causes of death in both developed and developing countries.
We're back here on MedTalk, still talking about oral cancer. Doctors, before we go to your book, let's inform all our viewers how to take better care of our oral health. You've mentioned all throughout the show the risk factors. You've mentioned, how to take care of our general well-being by eating all the fruits, the vegetables, and avoiding all the vices if possible. Other tips on how to take care of our oral health. Dr. Martinez.
Yeah, of course, we have to be conscious about our oral hygiene. So, brushing our teeth, using mouthwash also. Okay, and then we can actually do a regular examination of our oral cavity. So those are things that we can do. And we said, of course, lifestyle change, smoking, combining smoking and alcohol consumption increases the risk 15 times, no? So those are the things also that we have to look into. Healthy lifestyle, very important. As we mentioned earlier, also the diet. These are things. So the overall health has a lot to do with cancer in the first place.
Okay, thank you, Dr. Martinez.
Our society
Dr.
has
Vicente.
a very special tagline, which is pasilip ka. Pasilip ka. The Philippine Society of Otolaryngology, Head and Neck Surgery, has this one, the pasilip ka. The pasilip ka is part of our early detection cancer program, wherein we use an endoscope, okay? Because most of our areas are hidden from sight. Okay? Once you open your mouth, that's it. But underneath, at the back of the nose, down the throat, there are still hidden areas, and we need to investigate that as early as well. So we put something in a lighted end curved one or flexible one or a rigid one, looked into the nose, at the back of the nose, going down the throat, with a TV monitor, then that would eventually show us if there is a suspicious lesion inside the throat. So, pasilip ka.
Gaano kadalas kailangan magpasilip? Pasilip ka sa doktor?
Usually, I would recommend, especially once a year or twice a year, especially if you feel that you have this kind of problem, dull pain, if you have dull pain in the tongue or numbness in the tongue or so something like that, in the throat as well, okay, blood things phlegm. So, have your throat examined or ENT examined. Pasilip ka kagad.
Okay, thank you, doctors. Now, our Twitter question. Can I still play sports and can I swim if I have oral cancer? Dr. Martinez.
I don't think that will deter you from doing sports and even swimming if you have an oral cancer.
Okay. One more question, this time from Facebook. How many days will it take before I can eat normally again after treatment for oral cancer? Dr. Vicente?
We can at once eat. No? We can put a tube here first during oral surgery, after oral surgery. Are we talking about oral surgery already? Or?
Yes,
Yeah,
doctor.
oral surgery, we can put a tube there and then start eating right away on the next day. Or if most people already, especially if it would take a long time for the healing to take place, then we put some gastrostomy, we open the stomach and then put a tube there and then that's where you eat. So some people are very, don't want to have a tube there, especially when there's a lot of visitors visiting you.
Yes.
So they want to hide this one. So you look still beautiful.
That's still possible. No? Even with a reconstructive tongue, you're able to eat right away. Okay. World Cancer Day is coming up. Dr. Vicente, please tell us about this.
Yeah, we
and
have
tell
a
us
book,
about your book.
The Philippine Society of Oncology, wherein I am one of the directors and the past vice president of the society, has come up with the book, Facing Cancer with Care. Care is courage, adaptability, reassurance, and E is for energy. So we have to be, even if it's cancer, you have to develop this energy. It is a trilogy. The first part is a story, 10 stories of cancer survivors, okay, and cancer patients. It relates to us how they cope up during their times of crisis and eventually come up with a good positive thinking and eventually survive cancer. Okay? So the second part is what you said, it's the support care group. Okay? It puts us into something where how to cope up with depression, how the garden therapeutics, okay? Music therapy, okay? Positive thoughts. Forgiveness is also very important. We have to forgive everybody who we thought have sinned against us, or if we have sinned against them, so let's forgive them and be sorry also. Approach them as much as possible and tell them that you're sorry, even if they are the ones who hurt you.
Because it's really that positive attitude,
positive attitude
that will help in giving you that quality of life, or that positive attitude that will, how do you say that? Yung parang it will make you well. Yun talaga, aside from the medication, aside from the treatment your doctors are giving, aside from the support of family and friends, ikaw talaga, if you really want to get well, you will get well.
Of course, above all, faith and prayers. And we usually should pray, of course, and that improves your positive thinking. Okay? And usually I emphasize three things: prayers, prayers, and prayers. And number two is forgiveness, forgiveness, forgiveness. And lastly, positive thinking. Reverse your thought that you will definitely be cured after this bout of cancer.
Doctors, forgive me, but we don't have any more time. We've run out of time. We'd like to hear from you a final message to all our viewers. Dr. Vicente, World Cancer Day is coming up. Oral health must be emphasized as well. Final message to everyone.
Yeah, as a final word, as an ENT specialist, pasilip ka. Okay? So that's our tagline, and think it's very important for us to look into very hidden areas inside the ENT realm. Okay? And of course, very important is to hope you get a copy of this book, Facing Cancer with Care. And lastly, okay, stay healthy, okay, drink, sleep, and have that positive thought always.
Thank you very much, Dr. Vicente. Dr. Martinez.
Yeah, we'd like to emphasize on early detection because we said that the cure is practically 90% with early detection. And public awareness is very important as well. And we are very fortunate to have programs like this.
Thank you.
Which is for medical education purposes, and it will, of course, enlighten our public and empower the public also to try to do their self-examination as well.
Thank you very much, Dr. Martinez and Dr. Vicente, for empowering us with the information on how to take better care of our oral health. Maraming salamat.
Thank you.
See you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9 TV. This is Angel Jacob. Good night, everyone. Thank you, Doctor.